That's a, he can come in. Well, I just want to make sure the chef is with me. All right. Let's go ahead and get started. Good afternoon. I'm joined today by Commander Slappey of the 11th Precinct of the Detroit Police Department, Chef Q from the restaurant Cooking with Q, and Jamar Peterson, a medic from the Detroit Fire Department, as well as Denise Fair, our health director. And it's a sad day for Denise Fair and me. This is the worst part of these presentations, is we have lost another city employee, Antoinette Bell, who was an immunization advocate for the Detroit Health Department, has died of COVID-19. She was a huge part of our community's response. She was known to those around her as a prayer warrior. When parents would bring their children into the immunization clinic, she always greeted them with a huge smile and put those children at ease. And given how much the health department has done to really change the trajectory of COVID-19, it's all the more difficult when they lose one of their own. And in this case, Antoinette came from a family of public service. Her mother, Catherine Brown, is on our lead intervention team at the health department. It's a family that has been committed to the health of this community for many, many years, and everybody in the city feels the loss of Antoinette from our department. And it's even harder because as you look at what's happening in these numbers, we are continuing to succeed at beating the coronavirus, but it reminds us that every single loss affects us very deeply. Let me show you where the numbers are, and we're going to start to do these briefings Monday, Wednesday, and Friday. We're to the point now where things are enough under control we don't feel a need to do them every day as when we're in the midst of the crisis. But I think 3 days a week will be enough to give you a sense of where we're going, and also as we move to the conversation of how we reopen services, we'll be able to give you some guidance. So let me start with the chart that we use every day now, and I think Detroiters are getting familiar with, and that's the people that we have lost in this community. As I've said before, if this is going well, we should be cutting in half the number of deaths every week. That is a true trajectory down. And so we're giving you numbers here through Friday. I'm never confident on weekend numbers. We want to give them another day to make sure we're not underreporting. But if you just look at what's happened, again, 4 weeks ago, 266 of our neighbors we lost. 3 weeks ago, 277. It came down to 167 2 weeks ago, 93 a week ago, and 41 in the last 7 days. And so everything that everybody has done in this community is having a real effect. And I must get a half a dozen calls every day to do national TV shows, CNN, MSNBC, and the like. Fox hasn't called yet. I'm not sure why, but they all want to talk about what's happened in Detroit because it is really remarkable the way the people of the city have embraced social distancing. I know Detroiters are familiar with the fact that I will always give you metrics, but I want everybody to understand where we are right now. This is the governor's 6-phase plan for reopening the economy of the state, and I support it 100%. And so as she's pointed out, we went from uncontrolled growth to persistent spread and the governor says we are now in the third phase, which she calls flattening. What that means is that construction is now open. Manufacturing is open, and the supplier plants are opening today, and the assembly plants will be open next week. The auto companies are working with the UAW, real estate and outdoor work. So if you go around the city now, you'll see the landscaping crews are out, construction projects are starting, road projects are getting done. That is the flattening phase. 4 is improving. Here's the standard for when you move from 3 to 4. Your cases, your hospitalizations, and your deaths are clearly declining. We are very close to moving from phase 3 to phase 4 in the city of Detroit, and I expect it to happen in the next few weeks. What that means is this: businesses that are closed now will be allowed to open. Which ones are they? The governor defines them as other retail with limits, offices if teleworking isn't practical. So if you've got a shoe store, if you've got a clothing store, if you've got an art store, if you've got a bookstore, you've got the kind of business that people can come in and go back out. Those are the kinds of businesses that will open in phase 4. I'm still not clear on whether barbershops and hair salons are phase 4. They haven't given us guidance on that, but you can kind of get a sense of the other businesses. Now, phase 5 is when you're exchanging breaths with somebody. Sit-down restaurants, baseball games, casinos, movie theaters, where you're going to be sitting within a few feet of somebody. And of course, you think about a restaurant, even if you wear a mask into the restaurant, you can't have the mask on when you're eating. You're necessarily going to have to be exchanging breaths with folks in that environment. That's phase 5. But we could envision going into a clothing store, many of the shops along Michigan Avenue, but we're going to have to take precautions. And so on Wednesday, for those of you who have those kinds of businesses, we're going to talk about guidance on how to get ready for when we make that transition. But it is going to mean that your customers come in and wear masks. It's going to mean that your employees should be tested before they go back to work. It's going to mean cleaning protocols. It's going to mean people can't all be touching the same goods and then leaving them on the shelf. You're going to have some kind of standards, and they aren't going to be able to cluster together. But we are not that far away from opening up a lot more businesses, and we potentially could open a lot more offices if you don't have cubicles that are right up against each other, if you can create that 6-foot spacing. And I will keep saying this over and over. I'm going to show you some numbers in a minute that show this. Wearing a mask at work is going to be second nature. I wear my surgical mask all day. So does everybody in City Hall. It's second nature now. It's going to be second nature probably for another year. That's just the reality. We ought to just get used to wearing those surgical masks day in and day out. And I'm going to show you right now why it matters. So these are the numbers that we track every day. But since we opened the fairgrounds, we've got 20,700 tests back. We probably tested 25,000 people. We got some test results in progress. And overall, 23% of everybody who rode into that fairgrounds tested positive. In Detroit, 24% of Detroiters tested positive, 22% of suburbanites tested positive. This has been spread throughout the Tri-County area. This hasn't been a hot pocket in one community and not in another. Pretty much everybody in the Tri-County area has been exposed to this. But we started off with a lot higher infection rate. It's come down as we've gone along. I want to talk to you about the Detroit employees, because we're going to be bringing back about another 150 or 200 employees in the next week. We're going to bring back our building inspectors, our construction inspectors, our property maintenance inspectors, a number of lawyers in the law department, people working on housing repairs. Those are going to be coming back in the next week. And when we started bringing employees back in large numbers 2 weeks ago, I said it was my goal to create a work environment where you were at least as safe coming to work in the city of Detroit as if you had stayed home. That is absolutely our standard, and Dr. Dunn and the medical team have done a great job of putting these in place. So, since this whole coronavirus thing started in March, 313 employees of the Detroit Police Department have tested positive. 13% of the entire department has tested positive since the beginning. In the fire department, it's been 79 firefighters and EMTs, 7% of the fire department. And at DDOT, 8% of all the DDOT employees tested positive. The rest of the city has been about 3% of city employees. And so I know there was some controversy when I decided we should do hazard pay for DPD and the fire department and DDOT. But the hazard pay was based on objective evidence. The fact was, especially early on, our police officers, firefighters, DDOT employees, and a few other departments that were interacting with the public were just at greater risk. But when this all came about, we took a deep breath. We brought in Dr. Dunn. We put in the highest standard of medical protocols. And now, as folks up here can talk about, every employee is being tested when they come in for their temperature. They're being asked questions about their symptoms. They're wearing masks in patrol cars. They're wearing masks in the firehouses. They're wearing masks on the buses. And I want to show you the results. We are still testing our employees who are going to work or haven't been tested before. We bring a couple hundred of them in every day to our Abbott 50-minute tests. Since May 1st, the last 10 days, just bringing in the employees who haven't been tested before, we brought in 898 police officers who hadn't been tested. They're positive at a 1.5% rate. We brought in 229 firefighters. They're positive at a 2% rate. At DDOT, they've been positive at 3%, and the other city departments at 2%. Look at the difference. These medical protocols work. And here's the thing. Masks work. If everybody wore them, we could knock this down. But I want you to think about this. At the fairgrounds since May 1st, for all Detroiters, 8% of all Detroiters have tested positive at the fairgrounds from May 1st. These basically are people without symptoms who are just coming in without prescriptions for the most part. Now look at what you're seeing. Police officers, firefighters are less likely to test positive than Detroiters who have been sitting at home. This is telling you that the medical protocols that we are following are working. And it means as we open these construction sites, as we open these retail stores, if you will follow these same protocols, it can be done safely. Think about 2 police officers in a patrol car for an 8-hour shift sitting in the same car. Okay, when you see an infection rate like that, it means we screen the infectious folks out, and we had masks that were protecting the ones who are on site. So if it was so early we didn't even catch a temperature rise, you still weren't spreading it to your partner. I have said from the beginning, I'm going to keep saying it, the city of Detroit is going to have the highest standards of medical safety for bringing our employers back. And I know my friend the governor has a whole plan that she calls Safer at Home. But if you look at this, if you're a city of Detroit employee, we're proving that you can be safer at work if it's done right. We're going to keep testing this every single week because we're going to make sure that this doesn't start to slip on us, because more people congregate together, the more risk this is of spiking again. But if we keep tracking it every single day as we do, we think we can catch it early. But thank you to Dr. Dunn and to all the city employees. But we're going to keep bringing employees back as we can safely, and we hope to open more businesses. A couple of the things that we get a chance to talk about today. One is I want to thank Myers. It continues to seem like everybody in the country is behind the city of Detroit, but Myers has donated us 100,000 masks and more than 1 million pair of latex gloves. This is going to matter because we're going to make them available to businesses that need them for their customers. We want you to be able to reopen safely in the next few weeks. And so if you're starting to wonder, if I reopen, will I have the PPE in order to protect my customers and my employees. Over the next couple of weeks, we're going to work that out with you so that when the governor says we are phase 4 and open your doors, you'll be ready that first day to do it in a way that you can assure your customers and your employees they're staying safe. The last thing I want to do today is celebrate a remarkable program that we are wrapping up this week that we called Feed the Front Lines. And we have now served 20,000 meals to hospital workers, to police precincts, to firehouses, to the health department, to DDOT terminals, 126 different restaurants, and donors donated $400,000 so that the restaurants could earn some money making the food, and we can show our appreciation for the folks who left their house every day and did go out there to protect us. And I believe John Roach has managed to get a video that we're going to show how Feed the Front Lines has worked. John, is that going to work? Here we go. So everybody from Big Sean to Justin Verlander across this community. Last year, I was over on Woodward, and one of our Motor City match winners, Chef Q, opened up her new business. And she never imagined that she would have to adapt it to a pandemic, but she's been one of the entrepreneurs in this city that has figured out how to help feed this community even in the middle of this crisis. And with that, I'd like to turn it over to Chef Q.
Thank you. This has been like it's been an honorable situation. You never think as a business owner that when you open up a business, you're going to have to like shut down or a pandemic is going to happen. And the one thing that I did know was that our job was to provide healthy food to the community, and I didn't want to stop doing that. I wanted to make sure that we got healthy food to the community by any means necessary. And even through the pandemic, that was the first thought. How do we get healthy foods to our community members so that we can all eat to live? Because ultimately, that's what we want to do. And when Feed the Front Lines showed up and they wanted us to assist, it was like a layup. I wanted to do whatever I could by any means necessary. That program kept a lot of small businesses open. It kept a lot of people that actually work in the community with employment. And that's one of my biggest things. I wanted to make sure my team members could continue to eat and to make sure that the people that we come in contact would be able to eat and eat safely. So over $400,000 was donated by people just like you and me to make sure that the first responders didn't have to worry about a meal, because that's something that the doctors, the nurses, the restaurateurs, the police department, they worked all the hours. They worked day and night diligently to make sure that we were safe or to make sure that those who were sick were protected. And those donations fed over, 20,000 people. That's a huge deal. So I was just very appreciative, I was appreciative to be able to, work with Feed the Front Lines and make sure that I kept everybody healthy. So.
All right. Well, thank you, and I know your food was enjoyed in particular by Commander Slappey, who runs the 11th Precinct. Commander?
Yes, sir. Good afternoon, Mr. Mayor. On behalf of Chief Craig and the Detroit Police Department, we just want to say thank you so very much for the Feed the Frontline initiative. The foods we receive were always individually packaged for us. We always had between 2 to 3 entree choices, and oh my God, the food was absolutely delicious. And it was, to us, you could definitely tell that there was a whole lot of patience and a handful of love that definitely went into preparing these meals for the officers, and we truly appreciate it. For the Detroit Police Department, our motto is, we're a motto of sustained policing excellence that always put the people in our neighborhoods first, and this definitely holds true during this pandemic. And it is definitely a great morale booster for the officers to come to work and knowing that there is a great, delicious lunch waiting for them. It's definitely heartfelt, and there aren't enough words to express our gratitude.
And somebody who told me he's very much enjoyed the meals is a representative of Detroit EMS, Jamar Peterson. Jamar?
On behalf of the Detroit Fire Department, we want to thank everyone that was involved with the food that was donated to the fire department. It was greatly appreciated, definitely boosted morale. We work in 12 hours, and these calls come hour after hour, minute by minute, and at times it's very, tough to get food and to have food prepared. We talking about quality food here, and having our lieutenants deliver them to us was greatly appreciated. It definitely, made us feel appreciated. Very appreciated. And, we here at the fire department, we really, really appreciate it. Can't really find the words to express to you exactly how we feel. And we just want to thank everyone for doing that for us.
Special thank you to Carrie Jones, who likes to stay behind the scenes and not get credit, but she was the brains behind this operation and made it smoothly. So thank you to Carrie. And with that, we'll turn it over to our Health Director, Denise Fair.
Thank you, Mayor. I, too, also want to say thank you for those who participated in the Feed the Frontline program. I know at the Health Department, we also work several hours, and it's really good to get some nutritious meals, especially the vegan options, which I've thought for a moment that I may consider becoming vegan myself. So special thanks to Cooking with Q. Thank you. But today my heart is very heavy. Today we, as the mayor mentioned, lost one of our own, Antoinette Bell. She was a member of the health department, and she worked with us for about 3 years in the immunization clinic as a community advocate. She was loved by all. She really enjoyed her community and the work in the health department. She was inspired. She recently returned to school to become a social worker. One of her coworkers shared that she was gracious and she was a friend to everyone. So we extend our condolences to her family, especially Antoinette's mother, Nurse Brown. She was also a member of the health department in the lead prevention team. And this is, again, truly a great loss for the health department. So the number of new cases in our city is currently on the decline, but COVID-19 remains real. It's still a present danger in our community, so we must stay the course so that we can continue to slow the rate of this virus in Detroit. To date, we have confirmed 9,881 confirmed cases and 1,197 deaths. We are all grieving these terrible losses. The health department remains committed to mitigating the spread and also towards protecting the health and well-being of our citizens. Now, I'm pleased to share that we have completed our testing in the long-term care facilities this past Saturday, 1 week ahead of schedule. Testing was administered in 36 long-term care facilities. We initially targeted 37, but after verifying information that was provided to us, we learned that one facility had no residents. So again, we met our target of completing the long-term care facilities. Now, the results are continuing to come in. We have about half of the results so far, and the infection rate is at about 9%. So now we are directing our attention to our senior apartments. We're continuing that planning process to address almost 70 facilities who have to date been confirmed with COVID-19. This is going to be a massive undertaking. Again, we have about 10,000 units in the city of Detroit. Our goal is to be just as aggressive as we were with the nursing homes, and we still want to serve as a model for addressing COVID-19 in those congregate settings where this virus can wreak havoc with serious and deadly consequences. I really feel confident in our strategy. Been having a lot of conversations with the mayor, and we'll share specifics later this week. Now, as the city and the state begin to open up, we must continue to stay smart by keeping our distance, wearing our masks, cleaning high-touch surfaces, and of course, washing our hands. Although some of the restrictions are beginning to lift, our efforts towards protecting ourselves and those who we love should continue to be followed. And with that, I'll turn it over to the mayor.
We'll take any questions. The man with the antibodies.
Yes, it's me. I hope they tell me one day whether they're worth a damn, but I'm glad to be able to fog up my glasses while I have my mask on, so that's a small price to pay. ML Elric, Detroit Free Press. Ms. Fair, I wanted to see if we could follow up on the 10,000 units, and if we know how those units are broken down. I mean, are we talking about Sheridan 1 and 2 on Jefferson all the way down to a smaller facility, and are they all city-run? Are they privately run? Can you give us a better sense of where these are and how they're configured?
Sure. So it's a range. So there's 10,000 units across the entire city. It's about 79 facilities. So one facility could have about 100 units. Another could have close to 200. What we know is that we need to get started and start testing because in congregate settings, that's where COVID-19 is spreading pretty rapidly. To date, as I shared, there are about 70 facilities that have COVID. And so that's what I can share at this time.
Your description is accurate of the range of facilities.
Okay, and are they subsidized housing? Are they
It'll be everything.
city-owned?
Any place where, if you look at what's happening now, upwards of 90% of the people we have been losing in the last couple of weeks have been over the age of 60. And so we are going to target more and more of our efforts to our most elderly citizens. So it doesn't matter whether it's a city-owned senior center, a privately owned senior center, an assisted living facility, any place where people over the age of 60 are clustered, the health department is going to be sending teams in, and in many cases it's so much easier to go through the apartment building and take everybody's swabs and send them to the lab than to get all those folks to get in a car and go to the fairgrounds. So that's kind of the way we're looking at that is places where our elderly are clustered, we're going to go in more and more directly as we did in the nursing homes.
Okay, and Ms. Fair, will you also be testing staff members there as well, or is it primarily just the residents?
So our focus right now is the residents, but the staff are more than welcome to go to the state fairgrounds to get tested.
Okay, and is the city providing PPE for those staff members who may not get it through their employer or whoever runs the facility?
So that's currently part of our strategy, and so again, I'll be able to share that later on this week.
But that's
Okay.
what we've been doing that as we've gone along, and we'll continue.
Okay, and in terms of knowing about the presence of these facilities, are they licensed or regulated by the state or the city? I mean, is there a registry, or how do you know who fits the description of who you want to go and test and see how they're doing?
So apartments in this city all have to have a certificate of compliance, and they're registered with BC. We know who they are, and some specifically target people of particular ages. You have to be a certain age to be able to be there. We've got good lists on that.
Okay, okay. In terms of Feed the Front Lines, is this program continuing? Can people still donate? Can restaurants get involved, or is this something that's run its course?
It's wrapping up this week.
Okay,
So we want to thank the folks who were there. Yeah, this will be the last week.
okay. And as we're seeing in other cities and other states who may not have had as rigorous a testing program, people are starting to travel a little bit more. Is there any concern that people coming to Detroit who may not have had the opportunity to get tested, or who may not perhaps be as disciplined as Detroiters in terms of masks and social distancing, that they could pose a danger to residents or people who do business here or work here?
I get concerned about that every weekend when I go on Belle Isle. So the answer is, you look at the commitment that the people of Detroit have made, and it has been remarkable. And one of the things we're talking about is how do we make sure as the businesses open and folks come in, that they follow that. Of course, Ohio has opened up more quickly than Michigan has, so they have to deal with that sooner than we do. But it's something we're talking about, and I'm not sure what the right balance will be, but I'm hoping that the culture that's been embraced by the city of watching out for each other is also embraced by our visitors.
Given the city's ability to do more tests than it's many other places, and the resourcefulness the city has shown in terms of getting testing material, do you envision, or have you been invited or asked to take on a role on a larger basis, either by someone in Washington, perhaps by one of the campaigns, to talk about what's worked in Detroit and to maybe share some best practices that could be used in other places that seem to be still trying to find their way on how to get a handle on this?
We're consulted continually. The CDC has picked out southeastern Michigan as one of the first places to do its serology tests, and that's being done in partnership with the healthcare organizations across southeastern Michigan. Of course, the CDC has been embedded in the health department for a while, and I think has taken the practices nationally. And I'm continually on calls with mayors from across the country who want to talk about what we have done. But as far as a formal role, we're basically working 18 hours a day to protect Detroiters. So we're happy to help give advice, but we're going to stay focused on our own city.
Okay, I think that's it for my questions. Thank you very much.
Mayor, just a couple of questions from Kim and Craig at Channel 7, both related to DDOT. One was, as the progress continues to happen and different services tend to get activated, more businesses opening up, she wanted to know how long we expect to go with the free fares on the DDOT buses.
So Michael Oglesby started a week ago. He's an outstanding transit administrator, and I'm going to be looking for recommendations from him. And we're looking at a lot of things. We're talking to the drivers about whether we build some type of plastic shield in the front or whether the drivers think that's too restrictive. There's differing opinions, but we're talking that through with them. But I don't see opening the fare boxes anytime in the near future. But I'm gonna wait for Director Oglesby's recommendations.
Okay, and I think you answered the second question, which was an update on whether or not DDOT's going to install any partitions.
Yeah, and so I've talked to a lot of drivers, and the drivers have significant disagreement among themselves. And so I'm glad we have somebody with a national perspective on this, and we will provide the drivers a range of options. And Glenn Tolbert, the union president, is outstanding. I'm confident we'll get to the right decision. I'm open to doing it however the drivers think would best protect them.
Okay, his last question.
Okay, all right, thank you very much. All right, well, thank you.